It is time. It's time to begin our talk series. We would like to introduce to you our keynote speaker, Harold Koenig, whose lecture is entitled The Research Evidence Justifying the Integration of Spirituality into Clinical Practice. Dr. Koenig completed his undergraduate education at Stanford University, his medical school training at the University of California in San Francisco, and his geriatric medicine, psychiatry, and biostatistics training at Duke University. Dr. Koenig is a director of Duke's Center for Spirituality, Theology, and Health, and has published extensively in the fields of religion, spirituality, and health, with over 500 scientific peer-reviewed publications and book chapters, and more than 50 books in print in preparation for publication. Dr. Koenig?
Thank you. Well, it's great to be able to speak to you this afternoon, and I'm looking forward to the interaction on our panel and the questions that you all will be having. I'm going to present some information here for you that hopefully will provide you with some knowledge that can help you in your practice, and will help to help you also in realizing that what you do is very important and very effective for many people. So, in overview, first of all, I'm going to talk a little bit about the role that religion plays in coping. These slides are my notes, and so I can't see either of the projector screens. There's a little teeny, beautiful though, a little screen down here that, given my vision, I can't read. Okay, but we'll work with it. So we'll look at religion and coping with stress. We'll go over the research, looking at the connection between religion and physical and mental health. Now, I use the word religion a lot here. You can replace spirituality in there, and it'll be just fine. So, then we'll look at a theoretical model trying to explain how religion influences health, and then come up with some conclusions, and then provide you with some further resources that you can turn to for more information if you want to pursue this further. Okay, so first of all, we know, and some of this is pretty basic and pretty obvious for many of you. You've experienced it yourselves, so it's not something you really need evidence for, okay? But many persons turn to religion for comfort when they have to deal with problems in life. And there are many, many problems that confront us in our lives. And sometimes we just don't have enough to be able to cope with them ourselves. We need something more. We need help from somewhere else. And so people turn to their religious faith to find that help. Religion is often used to cope when people reach a certain threshold where they become uncertain about the future, when they begin to have anxiety and fear about what might happen, when they lose control, their own control of situations. That's when religion is often turned to help people make sense of difficult circumstances and to survive through those circumstances. And there was an old saying, I guess it was Abraham Lincoln, who said that when you have nowhere to go to your knees. So, a lot of times we're in situations where we don't have anywhere to go. We've kind of reached to our limits. And then where else do you go? Where else do you go? Some people go to drugs, alcohol. Some people dive into their work and consume themselves, so they're just thinking, they're focused on work, so they don't have to think about whatever it is that's going on in their life. People have various coping ways of dealing with this stress that we all have to go through. But religion, and the religions of all ages, seem to have provided answers and solutions for dealing with situations that help people really, to help them get through it and not have to pay the consequences of a lot of times what happens when you use other ways of coping to deal with situations. Because there are some good ways of coping that result in good outcomes, and there are some not so good ways of coping that result in bad outcomes, so that even if you were to get through the situation you're in, then you have to pay off whatever it is that you did in terms that was kind of a negative. You have to, after that, you have to deal with it. But with religion, ordinarily it seems that most religious ways of coping are healthy, lead to a person's growth in some way, such that they're further along the path, better off than they were beforehand, even before the stress. So in many respects, religion takes you not only through the stressor, but takes you beyond the stressor, to places where you might not have been able to go if it hadn't been for the stressor, and you're turning to your faith in order to deal with it. I see this a lot in post-traumatic stress disorder. As a psychiatrist, I deal with people, and I do research in veterans and military, members of the military, and they are, I see this literally happening, as they're trying to deal with this horrific stress and trauma in various ways, and how when we try to treat those individuals, we try to give them a vision of what could happen in their lives, could actually happen. So, so that's what we try to do. We try to show them that they are in a very unique situation in their life. And because most people, when things are going well and when you're feeling good and you're feeling at peace, you don't want to change anything. You don't really want to grow. You want to just stay the same. And that's natural, that's normal. You want to keep everything the same. You don't necessarily want to go do new things or create or go beyond what you're doing. You just want to do it because you want to stay feeling good. And then something bad happens, and it shakes you out of that. And when something traumatic experience, when it happens, there is a natural process that goes on in the brain that increases your adaptability. You're just more adaptive. The brain is more adaptive. We know that literally the brain cells are more, they're more plastic, which means there's greater plasticity, which means there's more likely that dendrites will grow out and connect with other parts of the brain. During situations of stress, particularly acute situations. And so, when you're going through stress, there's that opportunity for growth that was not present before, for going beyond where you were before. And it's only during those circumstances that people often will grow. And so religion is a way of kind of providing you with a little bit of direction on where to go when those situations that you're in create temptations to do things that are not really going to enable you to grow. Okay, but my talk here is supposed to be about the research. So let me return to that, because that's what I do. So many people turn to religion when they're experiencing stress. After September 11th, here's a study that was done. 9 out of 10 Americans turned to their religious faith to make sense of the fear, the anxiety that we all experienced after those terrorist attacks. And the question is, does it help? Does religious coping help? I made the hypothesis earlier, a few seconds ago, that that religion was of benefit, that religious coping led to growth. That was just a statement. That was a hypothesis. I didn't provide you with any evidence to support that. So what is the evidence that might support that religious involvement, religious activity, spiritual involvement, spiritual activity affects a person's health, or is associated with better health, or actually results in better mental, social, and possibly physical health? So let's look at mental health first. Now this research, if you're looking to find where it's at, and you want to have some objective evidence, then these are a couple of books. One is the Handbook of Religion and Health, which documents most of this research published prior to 2010 in peer-review medical journals. It documents it all in the appendix. So those studies are all in the appendix of the book. You can see when the study was done, the authors, the location of the study, how many participants were in it, what was the finding, what kind of religious or spiritual characteristics were measured, were other things considered in terms of controlling for or adjusting the associations for these other factors, and then the findings and the quality of the research design. So for each study, all of that is listed in the appendix of that particular, of those books. 2 volumes, 2001, 2012. The other book that just came out earlier this year is really focused on mental health. It summarizes the research prior to 2010 and brings into, discusses much of the research that has been done since the year 2010, over the last 8 years. And what it does, it describes the studies in great detail, looks at the methodology. So it is kind of academically oriented, but it does provide a lot of the logic and the rationale to explain how religion might influence a person's mental health. And then what do you do with that information clinically? Okay? How do you apply this clinical information to your practice, the care of the people that you see on a day-to-day basis? So here's a kind of review of that research, and much of it is probably what you would expect. But you know, remember that religion, spirituality, and mental health, for most of the last 100 years, were completely disconnected. I mean, with Freud's teachings, I mean, if you went through psychology or counseling, I mean, the only time it ever came up was as an illustration of some pathology. So that is really kind of where there's been a big, deep divide, and still is in many areas of the country and in many practitioners. I think there was a recent survey that showed that about 40% of mental health professionals in a particular society had any belief in God at all. Had, 40%, which is quite a bit different from the general population. I heard from Alexander that in Brazil it's 0.5% of people don't believe in God, which means 99.5% of the population believes in God. There seems to be a bit of a disconnect here between, it's not quite that high in the United States, but it's up there. It's probably above 90%, probably above maybe 95%. So there's a disconnect between and part of it has to do with the training. You go through this rigorous training for your professional career, and you learn and learn, and you learn all sorts of things. There's so much information to learn, but what is not included in there is the spiritual or the religious. So that's kind of pushed out. So that when you go into practice, and when you're mentored by people, they're not doing it, and so you just don't do it. And consequently, that's kind of what's happened. And then that sometimes also affects your own personal beliefs. If you had any beliefs yourself before going into the training program, they have been a lot of times squished out. So in any case, but in terms of depression, which is the most common and the most disabling of all conditions, second only to heart disease in the entire world. So many people don't realize that, how serious a condition that depression is. The most disabling of all medical conditions, more than diabetes, more than stroke, more than dementia, more than any other condition, second only to heart disease in the world, worldwide, not just, in the U.S. Okay. Well, of those, there have been 444 studies prior to the year 2010, and of those, about a little over 60% found that religious people, spiritual people, have, on average, experienced less depression. They recover more quickly from depression once they do develop it, and that when you do a spiritual or religious intervention, it reduces depressive symptoms. Okay, so there's a lot of research. The majority of the research that's looked at this finds that it does seem to be connected with less depression, which would suggest that people are coping better, because if you're overwhelmed with the situation and you're not coping, a lot of times people get depressed. So if you're less depressed, maybe you're coping a little better, and maybe religion is helping you to cope, which we would say, hey, that makes perfect sense. Okay. Here's a study. Here's a study in JAMA Psychiatry, which is considered one of the world's top psychiatry journals. And it's an older study now, several years old. And this was out of Columbia University. Columbia, that's in New York City. And it was it was by Lisa Miller and her colleagues, who were in the Department of Psychology, which is the same department that Richard Sloan is a member of, which is kind of ironic. Richard Sloan, by the way, is somebody who has kind of torn down all of this research, all of this clinical application, everything that Sonia introduced. He would just be absolutely against that. Well, he happens to be in the same department as Lisa Miller, who published this very interesting study on looking at the brain structure of people at high risk for depression. Now, they're at high risk for depression because their parent had a major depressive disorder. And so, if you're a child of someone with major depression, then you're more likely to get it, probably because of genetic factors that have been passed down. So what they found in another study was that the brain structure of people at high risk for depression was different than people who were at low risk for depression. There were many areas of their cerebral cortex, the very aspect of the brain that makes us human and differentiates us from animals. That parts of the surface of the brain were thinner, significantly thinner structurally when they did the magnetic resonance imaging scans of the brain. Then what they did was they divided those individuals into two groups. One group said that religion or spirituality was very important in their lives. The other group said that religion or spirituality was only somewhat important or not important at all. Okay, so you've got two groups, and then they're comparing their brains. All are at high risk for depression. And then here are the illustration of the findings. So if you look at the slide up there, you notice on the, I think it's your left-hand side, there are lots of areas of red. Those are significantly reduced areas of cortical thickness. And it's all aspects of the brain that it's presenting. It's the medial, the lateral, the inner part there, and all of that. And you can now, on the left-hand side, that's the brains of those for whom religion or spirituality was not very important. Okay, it was only somewhat, or it was not at all important. And on the right-hand side, you have the brains of those, on average, these are all averages, of those for whom religion was, or spirituality was very important. So if you compare these two, the brains in these slides, you can see there's a lot less red in those brains of those for whom religion was very, or spirituality was very important, suggesting that that perhaps their religious, spiritual beliefs and faith perhaps led to literally a change in their brain structure in terms of allowing those areas of the brain to now fluff out, now come out. So this is one of the most, I think, best evidences, objective evidence, that no matter what you say, that maybe religion makes a difference, spirituality makes a difference in the lives of those at high risk for depression, that you can actually see on their brain scans. Yes? It's a structural MRI, not an fMRI. I don't know. Anybody have an answer to that? Alexander? No, it's a thinning. It's actually thinning. It's the parts of the brain that are significantly thinner on structure. And that's in red. Yeah, in the various cuts there. Yeah, exactly. Yeah, it's like an average of everybody, Okay, good question to clarify. Okay, suicide, and it's reflected also this connection in the rates of suicide, which is very clinically applicable, because the thing we fear most as clinicians is that your patient will commit suicide. And so those who are more religious or spiritual, particularly if they're engaged in some kind of spiritual community, seem to be at lower risk of committing suicide in the vast majority of studies that have looked at this. There have been a lot of studies. And probably the best study that has been done thus far has looked at a very large sample. 80,000, I think, is a huge sample. 89,000 women who were nurses. This is called the Nurses' Health Study. This is the Harvard School of Public Health, and they followed them for about 15, 16, 17 years, maybe 18 years, I'm not sure. But in any case, they looked at the likelihood of dying by suicide among those who attended religious services compared to those who attended, less frequently or didn't attend at all. And what they found was that the likelihood of dying by suicide was 1/7, 1 divided by 7, 1/7, among those who attended religious services at least weekly or more often. So, so that was a very powerful finding. Now, if you notice one of those the large, bar. The large bar is for the U.S. population overall. That's the suicide rate, and it includes men. Okay, so that's why that's so high. But if you look at the other 4 bars, those 4 bars on the left are from the study. So again, that's where you get the 1 out of 1/7 the rate of suicide. And what was very interesting is that he sent a letter to the editor a couple of months later where he speculates on trying to explain why recently there was a report by the CDC that showed that women in the United States there was a dramatic increase in the rate of suicide between the years of 1999 and I think 2015 or something like that. There's a significant increase, something like a 40 or 50% increase in women, in particular in the United States. And this was very curious. They were trying to figure out why this was the case. Well, Tyler, when this study was done during that same period, the Nurses' Health Study, and he speculates that the reason why suicide rate has increased among women in the United States is because of the declining rate of religious attendance in the country. He says that that decline in attendance, given the findings of this study, would help to explain almost the entire increase in suicide rate reported by the CDC. So just the mere fact that studies of this type by the Harvard School of Public Health are appearing in the top psychiatry journals in the world, that means that this whole area that we're talking about here is starting to move into the mainstream. Move into the mainstream. It has been on the fringe, on the periphery, for a long time. It is now beginning to move into the mainstream by research like this. Okay, alcohol use, abuse, dependence, all of it less likely among those who are more religious or spiritual. Drug use, exactly the same. Well-being, happiness, again, the studies, and in particular, even more so than studies looking at negative mental health, like depression, anxiety, suicide, even more so the positive aspects of life. Well-being, happiness, life satisfaction, it's in those areas in particular that religious involvement seems to be associated with more of those. There were, in this review, which was a systematic review of the literature, 326 studies looked at these connections. Of those, close to 80% found that religious people are just happier. They just have more well-being. They're just more satisfied with the quality of their lives compared to those who are less religious, less religiously involved. Greater meaning and purpose, overwhelming number of studies indicate, and this meaning and purpose, those kinds of studies are done in people challenged with issues in their lives, usually health problems. Just the finding that over 90% of these studies, again, these are not cherry-picked, these studies. This is a systematic review of the peer review literature of what is out there for psychologists, psychiatrists, doctors, nurses, sociologists, counselors. This is simply a compilation of the studies done by them, published in their journals, finding this. So it's not like they're all coming, from our research, from the people in this room. It's from other people that are doing this work, which again lends to the credibility of the findings. Greater optimism. And of course, if you're having a person who is sick with a chronic illness or is in the hospital recovering from surgery or an accident, and that person has hope, is optimistic, has meaning and purpose, they're going to work harder in rehabilitation to get better. They're going to have more motivation because they have more reasons to live than the person who is discouraged, depressed, doesn't have hope, doesn't have any meaning or purpose, is negative, is cynical. That person is just not going to work as hard. They have less reason to work as hard. So these emotions, more of these positive emotions, have clear clinical consequences in terms of recovery from illness. Social support, again, after a while you kind of get bored. It's just saying the same thing, that the overwhelming number of studies seem to show that there are people who are more religious, not only have less, cope better, have less depression, have greater well-being, they have more friends, they seem to have just a better life, a more fulfilling and full life than those who are less engaged in religious practices. Delinquency and crime is less. Students do better in school. I know many of you got kids. You want them to do well. You want them to get good grade point average, graduate from high school, go to college. Religious kids are more likely to do that based on systematic studies. They're just more likely to achieve and do better. marriages seem to be better. They're more stable. There's less abuse. There's greater satisfaction when a couple practices their religious faith together in some way. They have a certain bond, that other couples just might not have, that goes beyond just the emotional bond. There's just a little more there, this common belief that goes really beyond even this life into the beyond, and goes deeper than one might be able to achieve just by human love, which is largely kind of a negotiated contract fired up by a lot of sexual drive, That's the normal. But people who have a similar religious faith and practice that faith together just seem to do better. Now, here is a model that tries to explain how and why religion influences mental health. So let's take a look at this. I'll try to unpack it for you. There is some evidence that there are some genetic factors that connect both religious involvement and mental health. These genetic factors are now just starting to be studied. We're not really sure exactly how it's influencing the connection between religion and mental health that I've been describing to you earlier. But it's more and more we're learning that predispositions that you inherit genetically make people either a little bit more prone to engage in spiritual practices, engage in religious or spiritual group kinds of activities, and tend to be more religious or spiritual. There just tend to be people who are just born that way, and that's because of their genetic makeup. That's part of it. It also probably has in part to do with biological factors. The fact that, disease and disability seems to be a little bit less among those who are more spiritual or religious. And we know that one of the strongest predictors of poor mental health seems to be poor physical health. So religious, spiritual people tend to take care of themselves, and so they're physically healthier, and so they're going to be less depressed, and they're going to have better mental health simply because they have better physical health. They don't have the burden of illness that they have to carry. There are psychological factors. There's the coping with stress. There's the attachment to God. There is the image of God. People assuming that well, you can't assume anything, but a positive image of God. What do we believe about the nature of God? Is God loving, good? Does he care? Is he involved? Or is God distant, uninvolved, uncaring, just kind of set everything into motion, and now is kind of a distant, parent who maybe kind of left the home, whatever? Or is it a punishing God that's always trying to catch us in our mistakes, that doesn't understand? Or is it a God that gives grace and mercy and really, really cares and wants our very best? So it depends on how you view God in terms of what that relationship is. And there are issues related to your environment. So religion probably begins affecting mental health from the womb, from the interuterine environment onwards, all the way to death. So let me explain that a little bit. So when a child is developing within the womb, the mother's neurological, endocrinological environment, the stress hormones, epinephrine, norepinephrine, cortisol, these are all different stress hormones, are circulating depending on what situation the mother is in. Is the mother in a bad marriage? Is the mother alone without a partner? Is the mother using drugs, alcohol? Is the mother working overtime and stressed out, unable to provide? All of those things are going to change the intrauterine environment, as opposed to a mother who is part of a family, who has a spouse, who is supportive, loving, a faith community to surround them, positive beliefs that help to cope with the stress, that avoids drugs, alcohol, and the environment's going to be better. And we know that stressed mothers, those hormones affect brain development. We know that, causing the child's brain, which the fastest rate of growth is when it's in the womb. That's one of the areas where the brain is growing very rapidly, especially towards the end of pregnancy. We know that those stress hormones are incredibly important. So it's right then and there that the religious of the parents is now contributing to the brain structure of the infant. Then it goes from there to the child is born. So the child comes into the world, and we know that within that first year, this development of basic trust is incredibly important for future ability to cope with stress and to have any relationship with any individual in their life. And so now you have the same situation. The child is there. The baby comes. Is the mother stressed? Does the mother have any support? Does the mother have a belief system that helps her make sense of other traumas in her life? Many religions really emphasize the value and the importance of children and child, and a child. And so it's a great value to have children, because children are so highly valued, so precious. So it's also all of that. Then the mother, trying to cope, etc., will maybe not be there for the child. May be depressed herself because of these issues. May be anxious and not able to handle the child. So now the child, now the brain is also growing. Now this is all affecting not only psychological but biological aspects of the brain and the ability to adapt later on in life. So then the child gets a little older, starts going into adolescence, and then all of the things start happening in terms of peer group influences, and then basically everything pretty much goes nowadays. There's no real standards, and so the child may or may not have a set of standards to follow. So religion provides the child, particularly a religious home, and being part of a faith community, provides certain standards that help guide the child in terms of decision making, which will determine whether or not they complete their high school because they don't have to drop out because they're pregnant, or because they're addicted to a drug, or because they're in juvenile hall, So having those guidelines then provides that child with the ability, the whole future trajectory of the life, and the ability to work and to have insurance and to be a contributor to the society as opposed to somebody who's taking from society. Then as people grow older and they get into middle age, and then they're raising their families. And then there are many decisions have to be made that religions provide guidance for. Healthy ways of treating your spouse and treating your children and spending time with your spouse. And also in terms of work, in terms of your ethical practices and the way you treat your coworkers, et cetera, all of which contribute, of course, to your success in your life and in your family and in your marriage and in having someone there when you get old and sick and you need a caregiver, as opposed to being alone, divorced, kids who want anything to do with you. You weren't there for them. You didn't really, and then you got nobody. And then you get older, and then finally, you're headed towards, the final lap around the track, and then you've got health issues. You're paying. Then you really need to have something that's going to help you to cope, and to face what nobody really knows is beyond. And so then religion is going to affect things then as well. So across the lifespan, religion is every step of the way affecting mental health, productivity, and ultimately health, all the way from the womb to the grave. So in conclusion, for this section, religion is commonly used to cope in response to stress, loss, and sickness. Religious involvement is associated with less depression, lower suicide, faster recovery from PTSD or other traumas, greater happiness, emotional well-being, less substance use and abuse, and better social and marital health. What about physical health? Well, we know that our emotions, our feelings, can influence our physiology. We know there are many connections, in particular between the brain and the cardiovascular system, particularly there. And you know that the bones, the bone marrow and the lymph nodes are heavily innervated by nerves as well. And many have wondered, okay, now why is that the case? Well, the reason why is because the brain is modulating the production actually of immune cells. And what do immune cells do, these immune cells, the bone marrow? It's the natural defense against all diseases and illnesses. It's your immune system fighting off cancers that are developing every moment in all of our bodies, even the young people in the audience. Their cells are, going off and the immune system finds them and eats them up. So it protects us throughout our life. And so the brain is modulating that system and the cardiovascular system. So whenever a wound heals, blood flow to it affects, healing and prevents infection, et cetera, et cetera. All of that is being modulated. So the natural systems in the body that heal it are being modulated by your attitudes, thoughts, emotions, and feelings. Modulated. So that means that if religious involvement, spiritual involvement, affect our mental health, then it might just affect our physical health based on these known pathways that we're being able to better understand more and more. So let's look, but let's look first of all, before we look at physical health, before we look at this mind-body relationship, part of the way that the mind affects the body is through what we do, how we behave. So religion is also related to that. Religious people tend to have more physical activity. They're more physically active. They tend to have less activity in the extramarital sex area. That's one activity they're less active in, which is, good in terms of all the venereal diseases and all the other complications that can result from those other activities. There is a problem with weight, but, we have to work with that. It tends to be the only sin that is allowed within most religious traditions is to eat. And it's encouraged. It's, anyway. So we got to modulate that a little bit too. Cigarette smoking, the evidence is absolutely overwhelming. Almost every study finds that those who are more religious, particularly among young people, they're less likely to smoke cigarettes. And they are less likely to start smoking. It's not so much that religion causes people to stop it, but it prevents them from just starting it in the first place, which of course is, if you're not smoking, that's going to have an effect on a whole bunch of systems that otherwise would be adversely affected, including, of course, your heart. Coronary artery disease is affected by cigarette smoking. Your blood pressure is affected. Stroke, chronic lung disease, and certainly lung cancer. So there's a whole lots of things. Some of the major killers relate to cigarette smoking. So if that was the only practice that religious or spiritual people did less of, it would explain the connection by itself. But there is more. And so also there is that psychological, social factors that affect our physical health. And that's the mechanism by which I think, I think there's more and more evidence that suggests that the way religious involvement is influencing physical health outcomes is through this stress hormone, psychological, social pathway. So people who are less stressed, people who are more socially engaged and supported, have better immune function. They have better endocrine functions. They have less stress hormones. Here's a study. This was one of the first studies that had been done looking at the immune system and religious involvement, finding that levels of immune functioning are better among those who are more engaged in a religious or spiritual community. They're measurably better. Interleukin-6, I can explain that. It's a pro-inflammatory cytokine which increases inflammation in the body, tends to increase with age. That's why people a lot of times get these age-related inflammatory diseases, including Alzheimer's disease and coronary artery disease, which inflammation is related to, as well as some cancers and dementia as well. So there's a lot of issues related to inflammation. And it seems that those who are more engaged in a faith community have lower levels of this pro-inflammatory molecule, or set of molecules. And that study has been replicated. Other researchers have found the same thing disconnected with our research group, have reported the same relationship through the same pathway with regard to lower inflammation among those who are more actively engaged in a religious community. Cardiovascular functions are better. Blood pressure in general, in the majority of studies, seems to be lower among those who are more religious. Their whole cardiovascular system seems to work in a healthier manner. They don't react as much to stress. Their blood pressure doesn't go up as fast. Their heart rate doesn't jump up when a stressor is caused. This has been done in the lab. Usually college students, they put them through some horrific experiment, and they check their blood pressure and all their cardiovascular. Those who are more religious, those students don't react as their system, it doesn't react as much. And of course, a lower cardiovascular reactivity is a positive thing. If your blood pressure goes way up when you experience stress, your heart rate goes way up, you're more likely to have damage, from the spike in the blood pressure. And then coronary artery disease is lower, as you would expect. You would expect that because we know coronary artery disease, there are stress related. The higher stress, the more likely you're going to have coronary artery disease. The less social support, the more likely. The higher blood pressure, the more likely. So again, all of this really makes some common sense. We're not just making a claim here that is just kind of out of the blue and it doesn't really make, it really makes perfect, logical, rational sense. What doesn't make much sense is that we're not doing anything about this. That's what doesn't make sense. That's what is really the disconnect. Why isn't the mainstream health system doing anything, giving an incredible volume of research data from multiple sources, from Harvard School of Public Health? You're going to ignore all of those things and just say, okay, well, we don't have time for that. We don't have time for, something that's going to affect everything in your life. You don't have time for that, the patient's life, everything. Their mental health, their social health, their physical health. Anyway, okay, so lower diastolic blood pressure, there's a study we did. Those who tend to be doing both the religious community, spiritual community involvement, engaging with others with similar beliefs, like you all, we're coming to a conference like this, engaging with one another. The combination of that with the private kinds of personal religious activities and beliefs, your connection with God, the transcendent, in the way that your faith guides you, the combination seems to work the best in terms of at least blood pressure, we think, based on this one study. It's only one study. And it's among a lot of these findings are not just within Christian populations. Now the majority are within Christian populations, 80 to 90%, simply because those are the only populations it's been studied in, because those are the countries that have enough money to be able to fund such studies. But there have been many other studies in other countries finding similar relationships with other religions as well. This is a study of Judaism. There's a 20% reduction in coronary artery disease among those Jewish men who were more engaged in their faith tradition compared to those who were not. open heart surgery, recovery from it seems to be better. This is out of Dartmouth, showing that those older adults, in their 6-month mortality rate after open heart surgery was significantly lower among those who had a strong religious coping, their religious faith, and were part of a religious or social community compared to those who were not. In fact, the likelihood of survival among those with that strong religious faith and community was 14 times greater than those who did not have that. 14 times. That was the odds ratio, 14.0 after things were controlled for in the analysis. And these are the Dartmouth, Medical Center investigators reporting this in, I think, Psychological Medicine. All-cause mortality. Now, mortality tends to be a good outcome to study simply because it is the cumulative effect across a lifetime of various kinds of activities, behaviors, and attitudes. It's the cumulative effect, how long you live. It takes into account all of the different ways of things that have affected your health throughout your lifespan. And then the final, of course, mortality does have some genetic roots and there are inherited predispositions, but everything else being equal, it's a nice cumulative indicator of health, of factors that influence health. And so if you look at the studies, and there are many studies, over 100, looking at the connection with religious involvement, it seems that those who are religious do live longer. They do live longer. There's no question about it. In the vast majority of studies, this is the most recent study, probably the best one done so far. It's out of the School of Public Health at Harvard. This was analyzed. The data were analyzed by Tyler Vanderweel, who's a professor of biostatistics at Harvard. And so they looked at all-cause mortality among the nurses in the nurses' nurses' health study. And what they found was that those who were more engaged in a religious community they had greater longevity, substantially greater longevity. And furthermore, what they found was a gradient of effect. In other words, the more engaged they were, the longer they lived. So there was a gradient in an effect. It's a very important statistical point that may not make much difference here, but statistically it makes a big difference because it provides some evidence for causality if you have a gradient of effect. And that's not only true for all-cause mortality in that study, it was true for, in particular, cardiovascular mortality. Because cardiovascular mortality is probably the cause of death that is most influenced by psychological and social factors. Again, we're following a rationale here that all of the pieces are beginning to fit together logically and rationally here. So this is what you would expect. You would expect in cardiovascular disease in particular, religion would have its greatest effect because it's so amenable to the psychological, social, and behavioral pathways that we've been describing that religion is connected with. Okay, and same for cancer. Although a little bit less, the effect isn't quite as large because cancer isn't as affected as much by psychosocial factors. There is some effect, and it shows here in that finding. Again, a gradient of effect. In all of these, there's a gradient of effect. So he tried to explain why. How on earth is this possible? What explains this relationship? They found that about 11% of the effect was due to lower depression. So these individuals who were more religiously involved had less depression. They weren't smoking. That was about 1/5 of the effect. They were more optimistic, more hopeful. They were more socially integrated. They had more social support, more social engagement. And about 1/3 was not explained, for whatever reason. Interestingly, there was no effect of alcohol use, diet, or anxiety on the effect. We don't really know why that had no effect, but it didn't. It was more these other factors. That's how religion seemed to do it. Organized religion seemed to have this effect on mortality. So here's a slide that summarizes pretty much all of the research. You want to have one slide, here it is. It's like thousands of studies on this one slide. Okay, so if you look on the one side there of the graph, you've got, your y-axis. You can see it goes up to like 2,000. I think it says that up there. But that's the number of studies, the actual number of quantitative studies. These are not just reports, subjective reports, case studies, people reporting subjective. These are where things have been measured quantitatively and looked at statistically. So thousands of studies there. So there are a few studies that find complex results. See that C down there? That means complex. In other words, after you read the study and looked at the findings, you couldn't figure out what they found or what they reported. It was so confusing, so poorly done. So there are about 100 studies like that. Then there are a few studies that find a negative relationship between religion and health. There are studies in the literature, in fact, quite a number, about 250, that find that in various populations, in various circumstances, that religious involvement is, spiritual involvement is related to worse health. Part of that has to do with the fact that as people get sicker, of course, they a lot of times turn to religion for comfort and hope, and it doesn't cure them, but for the people who weren't sick, they didn't need the religion. It kind of messes up your correlation here, basically. A few studies show a trend in that direction. A few studies show that depending on how you measure religious or spiritual beliefs and practices, you get various findings. So you might get a significant relationship with one type of practice and a negative relationship with another type of practice. When I say another type, I'm saying maybe like prayer. Prayer tends to be associated with worse health more generally simply because people pray more when they get sicker or unhealthy. It's a desperate attempt to cope. So it ends up being more positively correlated. Whereas with religious attendance, the opposite is the likelihood because, if you're able to attend religious services, then you're likely to be healthier. So the bias is that way. So with prayer, it's one way, and the other is that way. So you might find that in a cross-sectional study especially. Now here are the number of studies finding a trend towards better health among those who are more religious or spiritual. So there's a couple of hundred studies like that. Now the next bar is the number of studies finding a statistically significant relationship between religious or spiritual involvement and better health, psychological, social, behavioral, and physical. So that's very simply the finding. You can apologize, or I'm sorry I found this, but that's simply the way. If you do it, you're going to get the same finding. You could do this 100 times because it was a systematic review. It was a systematic which includes all of the studies, no matter what they found. So if you try to do this again, you get the same finding. Okay, and there are a number of studies that find no association, but overwhelmingly the association is positive. And this, of course, is evidence why integrating this into clinical practice, we ought to do it. We ought to be doing this and doing it more. Here's a kind of a causal model for the physical health effects. And, it's pretty much what I've been talking about here. This source, the source of the health benefits seems to be this connection with God, belief in connection with God, this sense of love of God, hope in God, faith in God. This all seems to, and this is nurtured within a religious or faith community, and then it's practiced out in public practices with others or private practices within oneself, and there are religious experiences and motivations and the turning to religion to cope. And all of that then is influencing the psychological traits and virtues that all seem to be really, really good for your psychological and social health, which are, okay, forgiveness, honesty, courage, all these things. You know, you probably, some of you went to Sunday school, you know, or with some traditional religion, you might have been, you know, this is what they're trying to drill in you when you're a kid. You know, you should forgive others, be honest, don't tell a lie, be courageous. You need to be self-disciplined. You need to love others, be altruistic, be humble about it, be patient with others, and be dependable. And of course, these are the traits that you are looking for if you're not already married. If you're looking for a spouse like this, you know. And if you are married, you're wishing your spouse was more like that. But in any case, and the reason why is because these generate positive emotions, these traits, in the end. They may not immediately generate them, but in the end, they tend to generate positive emotions. They tend to negate or get rid of negative emotions, and they tend to cause social bonding with others. And then all of that affects physical health. So that's one pathway. Another pathway is through health behaviors, daily decisions that people make that are influenced by their faith beliefs, and also genetic and developmental experiences influence this connection, like we talked about before. Okay, so it's complex. It's not like it's a real simple connection. And if you're sick, well, that means you're not spiritual enough or something like that. It just doesn't work that way. This is very complex. This model, in fact, is a moving model. It's actually something that is alive and changing. Everything is changing this model over time. And it's going both ways. Both ways. Mental, physical health is influencing religious or spiritual practices. Spiritual beliefs and practices are influencing mental and physical health. And that's changing over time in individuals as they go through life. So this is a very, and it's all influenced by various traits that people inherit or that they develop because of their infancy and their early environment that they had nothing to do with. So you can see the multiple factors. So any judgments that are made here, you know, you don't have enough information. Nobody knows everything here. So you can't make a judgment with regard to whether somebody is healthy or sick and whether they're religious or spiritual enough. Okay. That has to be made clear because in many faith communities, people make these judgments. Oh, well, you're saying, well, if you just did this more, then you wouldn't be sick. You know, be very careful with that. So in conclusion, religious involvement is related to better mental, social, and behavioral health, improves these aspects of health over time. As religious involvement lessens in the United States and the Western world, the result of increasing secularization, crime rates, alcohol, drug use, and addiction are increasing. That's pretty clear if you watch the news. There seems to be a lot of bad stuff on the news. Every day, it's new. Every hour, it seems to change. You look at CNN or Fox or, you know, CBS or whatever on the computer. You know, it's like every hour you change. After 1 hour, you look again. There's a whole new series of murders and addictions and everything. It seems like it's, and actually the data show that they are increasing. It's not going down. Religious involvement is also related to better physical health, less functional disability, and less cognitive decline with aging. So there's research, growing research, showing that people retain their memory longer if they are more religiously involved, spiritually involved. Their brains aren't subject to all of these stress hormones that are destroying the brain, basically. These findings have huge implications for public health and healthcare costs as religious involvement becomes less common with each younger cohort. So with people, you know, we're living longer with chronic disease. People who don't take care of themselves without self-discipline are sicker for longer periods, causing lots and lots of money to be expended, causing taxes to increase. Pretty soon we're not going to be able to catch up. The whole population is aging. This is a huge issue worldwide as medicine increases people's lifespans and as chronic illness increases in the population, more diabetes, more obesity, more stroke, disability, all of that is very expensive. Who's going to afford all this? We're running out of money. The clinical applications are vast in terms of provision of mental and physical health care. So that's basically it. I have about 2 minutes here. Here are some further resources. We have a monthly newsletter that provides the latest research. We summarize it every month and comment on it, the quality of the research, and various other, resources to learn more. It's free. All you got to do is go to the website, sign up for it. Doesn't cost anything. If you're interested in conducting research, here's a book that kind of summarizes that, how to go about doing research. It's based on our 5-day research workshop, which we hold every year. And so we've kind of taken the postdoctoral fellowship and crammed it into 5 days, and we spend those 5 days really drilling in how to conduct research, how to design a trial, how to try to get funding support for it, how to manage the trial, how to publish the findings. It's not much on clinical practice here. There's a little bit, but people learn, they're usually overwhelmed by the research. You see so many ways that you could apply this. So there is kind of some clinical stuff in the workshop, but it's mainly focused on research for young academics and for older individuals who want to know more about it. We have students in there. We have a range from undergraduate students all the way from undergraduates to professors at Harvard and Stanford and Johns Hopkins come to the workshop to learn how to do this research. So any of you are interested, it's the August of every year. Here's the book, Spirituality and Patient Care, that really focuses on the application. I know you're going to talk more about that today, but it's a little book that goes over that, kind of summarizes all of that. Here's that research book, the 2018 one. That's pretty expensive. It's about $80. But that's got the research. It's the latest, but it's expensive. Then there's a series of books that some of you might be interested in, looking at different religions and mental health. What are the different beliefs in each of these faith traditions? What is the research showing that beliefs in these traditions are associated with mental health? And what are the clinical applications, the practical clinical applications? These are all available for about $7. They're a lot cheaper than that other one. And then we got a video completely for free. You can go to our website. You can watch it. There are 5 highly professional videos. We was actually, we had somebody very highly skilled person do these videos. It was about $100,000. We had to pay them. There's part of a grant we got from the Templeton Foundation. There's 3 for physicians. There's one for nurses, and then there's one for chaplains or clergy. And there's our website. And if you are clinicians here, or counselors, psychologists, there's a little tab up there that says Religious CBT. It has a bunch of manuals that integrate spirituality, religion, into cognitive behavioral therapy for depression. So if you're interested, it's from Christian version, Hindu, Buddhist, Muslim, in fact 2 Muslim versions, one a Shia and a Sunni version, and it's got Jewish, everything we got up there. It's all for free, and it's patient workbooks. Just download them, and we're even talking about a Spiritist integrated CBT. I think Alexandra does it, but you could if you guys develop it, go up there, take the workbook, we'll put it up there. We'll put it right up on our website with all the other versions. So anyway, okay, I think my time is up. Here's a little book. Last thing I'll leave you with, a little tiny book. It's, I've written over 50 books. I plan on reaching 100. Could easily do that by the current rate, if I live, if I don't get sick. This is the best book I have ever written, and I will ever write. I'm absolutely convinced of it. I give this book to my patients who are really having a hard time. And many of them keep it at their bedside. So I think this is a pretty good book. And I think for the Spiritist tradition, given that, your beliefs in a loving God, I think this would be very consistent with your beliefs. Very consistent. So anyway, I've got to kind of leave you with that. And by the way, that hand there, see the hand in the water? That was done in the winter in North Carolina. That's my hand. So there's my son-in-law's hand. They're representing God, you know. Anyway, okay, so that's it. Thank you all.